Good morning, everybody. We are going to get started. It's exactly 11:15. And just right off the bat, I will let you know that you guys are all muted just because it is a lot of background noise if we unmute everybody, but there is a chat feature. So feel free to use the chat feature. Let me know if you have any questions through the chat feature, and let me know if you're having any difficulty hearing me or seeing the screen. At this point, you should see the Decoding Diabetes slide up on the screen, and you should be able to hear me as well as see my webcam too. So again, if you are having trouble with any of that, just send a note to the chat. I will keep an eye on that so that I can get back to you and help with anything that you may need. So again, thank you for joining us today. My name is Erica, and I am with Healthy at Hopkins. I'm the program manager for Healthy at Hopkins. We do many live webinars throughout the year. I will point out right off the bat that some are worth points towards the annual rewards program, and there are others that are not and that are just for educational value. So I will point out that today's is just for educational purposes. It is not worth points towards the 2019 rewards program. Like I said, we do a lot for educational reasons as well, and even though it's not worth points, it's still a really great seminar. And it's very informative for preventing and managing diabetes, especially since majority of the population, all of us know somebody that's affected by diabetes, whether it's ourselves, a family member, a friend, etc. So like I said, even though it's not necessarily worth points today, very educational, definitely worth your time to tune in. So we're going to get started. Like I said, feel free to use the chat feature throughout if you have any questions. We'll also do some poll questions, so when we get there, you will use the chat feature to answer those, and I can see your answers, and we'll go from there. So again, welcome. My name is Erica, and we are going to dive right in here. We are going to talk all about tips for prevention and management of diabetes and how to decode diabetes a little bit. So like I said, most of us know someone that is affected by diabetes. It has a huge impact on so many people. And in 2017, the Center for Disease Control and Prevention reported that 30 million adults had diabetes, and that's actually up from 26 million in 2010. So it's rapidly increasing, which is concerning, and that's why it's so important to get an understanding and an education on where diabetes comes from and how we can potentially prevent it. In general, what's even more shocking is that 1 in 4 people are actually not diagnosed with diabetes and has diabetes. So 1 in 4 people has diabetes and has no idea. So that's another reason that the education here is so important. And in the short term, the symptoms of diabetes can be mild, so they are relatively easy to ignore, and that's another issue with it. It can go untreated for years just because so many people don't necessarily have symptoms or realize that their symptoms are actually pointing in the direction of diabetes. So we're going to dive in here today, and in today's seminar in general, we're going to learn the basics of preventing and managing. So we're going to talk about what diabetes is. We're going to talk about our risk and what we need to be paying attention to as an individual, and then also how to promote health and disease risk and decrease risk in general. So we're going to dive into all kinds of good information. This information can apply to everybody, and although you may be healthy, you still not necessarily are not at risk. So even as a healthy individual, this is stuff that we want to pay attention to. If you're already diagnosed, we'll dive into all kinds of tips and tricks that can be helpful for you as an individual as well. So like I said, this information that we'll talk about today can apply to everybody. We'll start out by talking about what diabetes means for our bodies and our risk as an individual, and then we'll also talk about the 4 key lifestyle habits that can impact us. So let's talk first about the different types of diabetes. So we have 4 of them listed on the screen. And so one person did mention that they can't hear anything. Make sure that your volume is on your computer. We've only had one person say that, so majority of the time we have a ton of people message us if they can't hear as well. So just make sure that you have some volume turned on there. Sorry, so we'll dive back in. There are different types of diabetes, and you may have heard of some of them before, maybe not all of them, but we'll touch on each one really quick. So prediabetes is the condition that can develop into type 2 diabetes down the road. If lifestyle changes aren't made, it typically does lead to being diagnosed with diabetes. In prediabetes, your blood sugar is higher than normal, but it hasn't necessarily reached the level that is indicated as diabetes just yet. So we'll talk about all the numbers a little bit later, but it usually doesn't require medication if you're pre-diabetic. It is just more so of a warning sign. So it is a time when you need to consider making lifestyle changes so that you don't hit diabetes down the road or get diagnosed with diabetes down the road. And diagnosis is when your doctor detects a certain number and tells you about the condition for the first time. So when you are diagnosed with prediabetes, like I said, more so a warning sign, not necessarily time to be put on medication or anything like that just yet. We also have type 1 diabetes. So type 1 is an autoimmune disease that can affect anyone. Usually, it's diagnosed earlier in life than type 2 diabetes. And as far as we know right now, unfortunately, lifestyle habits don't have any effect on preventing type 1 diabetes. So once you have it, it's more so about management at that point and using insulin to manage it. And we'll dive into all of that in a little bit here. We also have gestational diabetes, which is a condition that develops in women that are pregnant. They typically do not have diabetes pre-pregnancy, and it needs to be treated to prevent problems for the mother and the baby. It can be prevented and managed with similar ways that are in type 2, which we'll talk about in just a minute. And women who do develop gestational diabetes during pregnancy are at a higher risk of developing type 2 diabetes later in life. And this is the last time in our presentation that you'll be hearing about those specific types, type 1 and gestational. We will be focusing more so on type 2 diabetes. This is the most common of the different forms of diabetes, and it makes up about 90 to 95% of diabetes cases. So that is why we are going to dive mainly into type 2 today. The good thing is type 2 diabetes can be prevented. It can also be managed through lifestyle choices. The average age of diagnosis is generally 45 and older, but that being said, obesity is a risk factor, and since more youth and young adults have obesity than in the past, now type 2 diabetes can pretty much be found at any age, and it is starting to be diagnosed at a younger age. Type 2 diabetes can be difficult to understand. Obviously, there are so many different things going on in the body. So it's really important to first get an understanding of what's happening and what is different about somebody's body that has diabetes versus somebody's body that is functioning at a normal level with our metabolism. So we're going to talk about a healthy metabolism. We're going to start off by just trying to understand a normal metabolism and how that works. So metabolism in general is the process of turning the food we eat into energy so that our bodies can function. And this process is impacted when you have diabetes. So diabetes primarily affects the ability for our body to actually store and use carbohydrates that we eat. And in somebody without diabetes, this is the normal process when we eat carbohydrates that you will see on the screen right now. So we first eat the carbohydrates, whether it be from a food or from a beverage. Then the carbohydrates are digested in our stomach. They are then broken down into glucose, which is also known as sugar. And throughout the presentation, we will refer to blood sugar and blood glucose interchangeably. So you'll hear me use both of those terms. But sugar is absorbed into the bloodstream next, and this raises our blood sugar. The body then releases insulin, and insulin is a hormone that helps us to keep our blood sugar stable. Insulin binds to the muscle and the fat cells to create a portal so that the sugar can enter. And then from there, our cells use the sugar as energy to power our body and our mind. And then any sugar that is not taken up by the cells is stored in fat cells or in the liver. So that is the typical process for somebody that has a normal, healthy metabolism. We're going to also look at a deeper dive into insulin and what is its role in general in this. So the role of insulin. Essentially, insulin acts as a key that allows us to unlock the door to our cells. So you can think about it that way. And this allows sugar to enter. In type 2 diabetes, though, anybody with type 2 diabetes, one of two things may be happening. First, the body may not produce enough insulin, so that could be the issue. Or second, the cells may not be responsive, so they may not respond effectively to insulin. This is also known as insulin resistance, and insulin isn't able to open up the door to the cells like it's supposed to. So if you look at the two images there on the screen, you will see that on the left is the cell of a person with diabetes. There are either not enough keys or insulin to unlock the cell so that the sugar can enter, or the cell does not respond to the key as it's supposed to, and then the cells do not respond to the insulin being produced, is what we're saying. But then on the right there, you will see a cell of a person without diabetes, and insulin is able to unlock the cell so that the sugar can enter. This lowers the blood sugar level, and it also gives our cells energy to function. So type 2 diabetes symptoms may develop slowly, like I said earlier. Sometimes they are so mild that they're not even detected, but in general, you can have type 2 diabetes for potentially years and not even know it because of this. So it is an issue that they are so mild, and that is why it's so important to be tested and know if you are at risk for diabetes in general. It's really important to see your doctor on a regular basis and make sure that you are monitored and screened to see what your risk is. Common symptoms are listed on this slide here. We have increased thirst, feeling more thirsty than usual, maybe drinking more than usual and noticing an increase in the fluids that you're taking in. Also increased urination, so going to the bathroom more than usual in general. We also have blurred vision, feeling tired, any kind of numbness in your hands and or your feet, sores that do not heal properly, and then even unexplained weight loss can occur as well. So your doctor may be able to assess your risk of diabetes before you actually end up with it. They can do screenings using blood work to see where you stand currently and where your risk is. If your blood sugar is higher than it should be, but not as high as being diagnosed with diabetes, you may be told that you have prediabetes. And this may seem scary, but at the same time, it is actually really important and good to know that you are heading towards diabetes, because at that point, prediabetes is like the yellow caution light on a stop sign. It is that moment of knowing that something needs to be changed so that you don't go down the path further. If you keep up with your same lifestyle habits at that point, you may continue down the same road and end up with diabetes. However, if you take caution and adopt healthier habits in general, you can reduce your risk of diabetes. So it is possible to prevent or delay diabetes. So that's extremely important to know. It is very possible to prevent type 2 diabetes. If you are diagnosed with prediabetes, it is the time to make lifestyle choices at that point. And in some cases, your blood sugar levels may even become normal again if you do make lifestyle changes. So we have our first poll question. You will see this on the screen here, and it is, how can type 2 diabetes be diagnosed? A, identifying associated symptoms. B, hemoglobin A1C test. C, fasting blood glucose test. D, both B and C. E, all of the above. So feel free to use the chat feature and send what you believe the correct answer is. I'm going to give you guys about 30 more seconds here, and then we'll go through the answer and why it's the answer. So we have a lot of E's, couple D. All righty, thank you all for responding. More D, more E. So everybody either said D or E. And the correct answer is actually D. So symptoms may suggest that you have diabetes, and they may indicate that it's time to go to a doctor and get tested. But the fasting blood glucose test and the hemoglobin A1C tests are the actual ways to confirm. So a doctor will not confirm or diagnose diabetes unless one of those tests has been completed. So let's dive into the numbers a bit more and what would actually show up if you go and get one of these tests done. Diabetes is diagnosed through blood testing. So the most common test is the fasting blood glucose test. This looks at your blood sugar level after not having eaten for at least 8 hours. So majority of the time you do need to fast to get this type of testing done. And your doctor would indicate that and let you know that before your actual appointment that you would have. So fasting blood glucose test, or FBG, if the results are 126 or above, this could indicate diabetes. And a FBG of 1 to 125 could indicate prediabetes. So this is that warning sign of if you do fall in that 100 to 125 range, that is when you have been indicated that it's a good idea to consider lifestyle changes a bit. The last one on there is normal, so that is actually 99 or below when you get this testing completed. FBG looks at only one snapshot in time, so it's looking at that current amount in your bloodstream. It looks at your blood sugar on one specific day. So your healthcare provider may also use tests that reveal average blood sugar over a longer period of time, and this gives them a better idea of where you stand. So this is the hemoglobin A1C, and it is another test that your doctor can potentially perform. It shows what your blood sugar level has been over the past 3 months on average. So it's a little better of an indicator just because, like I said, it doesn't look at that one pinpointed day and time. It looks at your average over 3 months, and this does give a better picture of your true blood sugar level and your trends. When you have diabetes, this is the test that your healthcare provider will use to understand how well you're controlling your diabetes and your blood sugar levels. They also can use this information to develop a plan of care for you. So depending on the numbers and the results each time you do this, it can help to shape your care plan a little bit. The numbers are on the screen there. Normal is below 5.7, prediabetes 5.7 to 6.4, and you will be diagnosed with diabetes at 6.5 or above. So as we said before, the short-term symptoms of type 2 diabetes may be so mild that they can go unnoticed for years. However, there are long-term complications that can arise from untreated or misdiagnosed diabetes and just high blood sugar in general. There are serious complications that can take place if no diagnosis is known. And so that's why, like we talked about earlier, it is so important to see your doctor and get tested. Medical costs could potentially include developing other conditions that are linked to diabetes as well. If it does go undiagnosed, it could lead to potential heart disease, stroke, and this is more likely in those with diabetes. Also neuropathy or nerve damage. So if you do have diabetes, you can end up experiencing tingling sensation, pain, or even loss of feeling in different body parts. There's also eye damage that can occur, vision impairment or blindness, potentially kidney disease as well, which is when untreated or mismanaged diabetes occurs. It can end up leading to kidneys that are trying to work harder than they should have to, and it wears them out. And then poor wound healing as well. The normal healing process that occurs when you get wounded is slowed by diabetes. So unfortunately, this can lead to issues and even amputation. Personal costs that can potentially arise from this, higher medical costs in general. On average, someone with diabetes spends more than twice as much on medical expenses comparing to somebody without diabetes. So this amount will increase even more if diabetes is mismanaged or if any kind of complications do arise. Also, decreased productivity at work and at home, lost wages, and then decreased quality of life in general. A lot of medical complications can arise if you do have diabetes, so it can decrease how active we are and decrease our quality of life in general. All reasons we want to make sure that we are tested frequently, and if we are in that pre-diabetes range, we do something about it. So true or false, eating sugar causes type 2 diabetes? This is our second poll question, so feel free to send the answer to the chat again. So we do have a mix of answers. Okay, so most people are saying false. We have a couple true, but majority are false. And false is the correct answer. So based on what we just learned, we know that in general, eating sugar may not always be the best option, and we'll get into that with nutrition in a little bit, but type 2 diabetes is caused by lifestyle factors in general, not just sugar. In general, eating a diet higher in calories than your body needs can increase our risk because of weight gain, and this can potentially lead to type 2 diabetes, but it's not necessarily eating sugar that is causing that type 2 diabetes. Like I said, we'll dive way more into nutrition in just a little bit too. Taking care of your health is important whether you're at risk for diabetes or not. It becomes even more critical when you know you have a greater chance of one day being impacted. In general, anybody can be impacted, like we talked about earlier. Everyone is truly at risk, so we just need to know how at risk we are so that we're more cautious. Your doctor can determine what your personal risk is by reviewing your risk factors. They are listed on the screen here. We have being overweight or obese, which just in general, a higher body fat percentage than normal is a risk. Physical inactivity, so not regularly moving the body for exercise is a risk. Tobacco use, smoking cigarettes, cigars, or any tobacco product can put us more at risk for diabetes. High blood sugar, so blood sugar that is higher than the normal range. Same with high fasting blood glucose, if that's higher than it should be, that's a risk. History of gestational diabetes, so this puts women at higher risk in general. Age, if it's 45 and older. Family history, so if anybody in your family does have diabetes, that obviously puts you at a higher risk because of genetics. Polycystic ovarian syndrome, again, this puts women at higher risk. And race or ethnicity, African American, Latino, and Native American are at higher risk as well. So risk factors are a mix of lifestyle factors and genetic factors. Obviously, we don't have control over our genetic factors since they can't be changed. But if we already know that we have a genetic risk, it's even more of a reason to try to control what we can control and definitely take control over the risks that we have in our ability to change. So we definitely want to modify our lifestyle factors in general, but even more so if you have genetic background of diabetes, you want to pay more attention to your lifestyle factors. Your doctor will look at your lifestyle and genetic factors to get a better picture of your overall health and also your diabetes risk. And then healthy lifestyle changes are effective ways. There are many effective ways to reduce your risk. The medical goal of diabetes is blood sugar control. So that is the bottom line here. When your blood sugar remains stable over time, it means that your personalized plan of care is working for you. You can learn this from doing your A1C testing, and this goal applies whether you are trying to prevent diabetes or trying to manage diagnosis. Either way, you want to definitely have an idea of where your blood sugar is typically falling. You may be prescribed oral medications, maybe insulin injections, and or lifestyle changes such as diet and exercise to potentially meet this goal and to lower your numbers. Visit your doctor to check in if your blood sugar is consistently out of range despite following their recommendations. So our bodies do change. It may be a sign that the routine that you've been following for even a really long time is no longer right for you. And the changes you make can better control your blood sugar in general. So they can positively impact other parts of your life as well. If you make healthier food choices, you're able to lose weight. Maybe you can now run around with your kids a little bit more. Just in general, any healthy lifestyle change that you may make to prevent diabetes is going to benefit you in other ways as well. And it's just important to know whether or not your plan of care is still working, because that can change for sure. And just think about how these lifestyle changes will have a positive impact on your life. Why are these changes important and meaningful for you? And think about whether it's so that you can run around with your children, or so that you do prevent diabetes down the road if one of your parents had it, or you want to be able to run a 5K, so you want to be able to be a little bit more physically active. There are definitely roadblocks that will come up throughout, but you keep them on your radar, and if you know how you're going to manage those roadblocks, you'll get a lot farther. So key lifestyle changes. Diabetes can be prevented or managed through lifestyle change, like we talked about. So what can you do to make a difference? Your diabetes risk can be reduced with regular doctor's visits. So that's on there. Right off the bat, you want to make sure that you are getting that annual physical. Make sure that you have been tested to see where your A1C is falling. Weight management, helpful. Nutrition, being aware of what you're putting into your body every day. And then regular physical activity. If you've been diagnosed already, these habits play a role in how well managed your blood sugar is going to be. So we'll talk about each area in the next few slides. We're going to dive into all 4 of these. If big changes do seem overwhelming, it's okay to make small and gradual changes. Just know that it's not expected, nor is it realistic to think that you can totally change your lifestyle and your whole plan overnight. Maybe start with one little goal for nutrition, or maybe say, I'm going to start walking twice a week to incorporate some physical activity. And then once you accomplish a goal, you can obviously add a new one. But you might find that it works a little bit better to do one small goal at a time and not feel completely overwhelmed by change. The first key piece to preventing and managing diabetes is getting regular checkups and screenings with your doctor. So we're going to dive into this a little bit more, just because this can help you to understand your risk, and it can help you to monitor your health in general, not even just with diabetes, but your health overall. They can also track if and how it is changing over time for your care plan. This will help you to know where you're standing with your risks still, if your blood sugar levels are more in check these days, or if they're getting a little out of check and we need to reevaluate. But routine checkups are key, and they are important regardless of whether you have diabetes or not. If you do have diabetes, checkups are even more important for making sure that your diabetes care routine is still working for you. So, like I said earlier, the body can change over time, and it is possible that your same routine, even if you've been doing it for years, maybe needing even just a tiny tweak to be more effective. And it's important to make sure it's effective. Your body, with that change, may need a different type of medication now, or it might need just a little bit of an increase in that medication. You just want to make sure that your blood sugar is being completely controlled. They also your doctor might recommend more lifestyle changes. Maybe if you've already incorporated physical activity, now it's important to pay attention to your eating habits, or your body weight in general. So the American Diabetes Association does recommend a yearly screening for diabetes if you have any risk factors that we mentioned earlier. So if you do have risk factors, it is important for you to be cautious and get a yearly check. If you do not have any risk factors, you'll see on the screen there, it is recommended every 3 years after the age of 45 that you have your blood sugar checked so that you know where you're falling. Many people have prediabetes or diabetes and don't even know it. So that is what we've been saying this entire time. That is why it is so important to get screened. If you have those risk factors, go every year. If you do not, and you are over the age of 45 and have not had yours checked, now is probably the time. Weight management. So weight is more than just a number. Extra body fat does affect how our body functions on a daily basis. Many doctors use BMI or body mass index as a way to assess our weight and our body fat. So There are many other indicators that we can take into account when assessing our overall health and our diabetes risk. Your doctor or a registered dietitian or nutritionist can definitely help you determine what is a healthy weight for you. And they can also help you to achieve weight loss in a healthful, sustainable manner if it could benefit you. It is recommended that you consider different things during weight loss, though. We don't want to just dive right in. We want a plan to go off of, and we want to talk about what healthy weight loss is, because there are plenty of ways out there that are not defined as a healthy weight loss. So we will talk about how even small changes in weight can make a huge difference. I think this number is encouraging because even losing 5 to 7% of body weight decreases the risk of developing diabetes by 58%. So this is about 10 pounds for someone who weighs 200 pounds. So a 200-pound person loses 10 pounds, they could potentially be decreasing the risk of diabetes for themselves by 58%, which is huge. So take that into consideration, but then also know that gradual weight loss is important, losing 1 to 2 pounds per week. It's not necessarily healthy to follow one of those fad diets and drop 8 to 10 pounds in a week. So we do want to pay attention to healthy weight loss so that we can maintain and sustain it as well. Weight loss should be achieved through a balance of diet, exercise, and other lifestyle changes as well. Another poll, so which of the following habits can help with promoting a healthy weight? We have A, managing stress, B, enough sleep, C, focusing on nutritious foods, D, reducing sit time, or E, all of the above. Yeah, I'm not going to give you guys too much time for this one because everybody's already flooding in with the answer being E. Yep, all of the above. So these lifestyle habits can all play a role in maintaining a healthy weight. Nutrition and physical activity tend to have a more direct impact, but that being said, all of these things can have an impact. If you think about it, if you don't get enough sleep and you're exhausted and you don't make it to the gym after work, so you don't get your physical activity in, that is all playing a role. So every single one of these promotes a healthy weight. We're going to dive into nutrition, like I said earlier. So nutrition plays a large role in overall health, and especially with diabetes. We're not talking about fad diets. Oftentimes people think that fad diets is the way to go, whether it be fasting for days, just having juices for days. There's a lot of fad diets out there that are not necessarily backed by research. So we are talking about realistic eating patterns that mean that we're focusing on healthy foods and getting the nutrition and the vitamins and minerals that we need. So this means vegetables, fruits, whole grains, proteins, healthy fats, and even carbohydrates. However, it is possible that your doctor will recommend a controlled carbohydrate diet if you do have diabetes or prediabetes. This might mean spreading your carbs out throughout the day or sticking to a certain amount. Maybe having a whole grain with breakfast and a whole grain with dinner, etc. Your doctor can easily talk to you about all of that. It's not necessarily cutting carbs, though. So many people think you have to completely cut carbohydrates. We want healthy carbohydrates. They are helpful for our bodies. We need that fiber. So we'll talk more all about that. But a registered dietitian or a certified diabetes educator can help you create a diabetes eating plan that does meet your preferences. They can also teach you how to balance food, and they can talk about meal plans, etc. Finally, they can share how much and when to eat to keep your blood sugar stable, and how many carbohydrates and when to eat them to keep your blood sugar the most stable possible. You'll know you found an eating plan that works for you when your body they are broken down into sugars when they are digested. So these foods tend to have a larger impact on our blood affect our mood or our energy level. So those that are listed on the screen here are good options. We have fruits and vegetables. Certain fruits and vegetables, some starchy vegetables like corn, potatoes, and peas contain more carbohydrates and have a larger impact on our blood sugar than non-starchy vegetables or water-rich fruits, which is a good option. So we have melon, berries. Those are a little bit more water-rich and less carbohydrate. Plus, they all contain fiber. We also have beans and lentils listed. So these contain fiber as well. We have grains that are always a good option. We always want to choose whole grains. So this includes oats, barley, brown rice. If you're going to have pasta, some type of wheat pasta or wheat bread, whole grain bread is definitely the better option because it has that fiber, so it will help our body to digest better. Dairy does not contain any fiber since fiber is only found in plants. That being said, it does contain protein. So if you're going to choose a dairy, maybe a Greek yogurt that has some protein included in there, this is another nutrient that helps carbohydrates to be absorbed more slowly into the blood. So like we just said, fiber is found in plant foods. Fiber comes from these, and that means that there is no fiber in animal products like meat, milk, or eggs. So good sources of fiber does include those beans, fruits, veggies, and some whole grains, even nuts as well. So there are several benefits to fiber. Not only does it help us control our blood sugar, but it also helps us to feel full and satisfied after eating. So we want to incorporate more fiber so that we control how much we eat as well. And then you can also look for fiber on the nutrition label. It is right above where sugar is listed when you look at a nutrition label. Really quick, so we are going to go through these just in the essence of time. I'm going to go through them and talk through really quick. But we have different foods listed here. Whole grain bread is high in fiber, so is black beans. Orange juice is not. It's lower. Even if it has the pulp in there, you would get more fiber from having a whole orange itself. Apple, a lot of fiber, but you want to make sure to keep the skin on it as well, because a lot of the fiber does come from the skin of the apple. Same with a baked potato. A baked sweet potato, it is higher as long as you keep that skin on. Mashed potatoes are lower because we often take off the skin for those. But if you keep the skin on, you will get a little bit more fiber in there. White rice is lower. You want to definitely consider brown rice or some type of wild rice or whole grain, and then you'll get more fiber out of that. Quinoa is high in fiber, as well as carrots. Sugars. So we have natural sugars and added sugars, which is something else that we definitely want to take into consideration. Despite what food marketers might lead you to believe, there are only two forms of natural sugar, and those are milk, which is lactose, and the second is found in fruit, which is called fructose. So those are the two natural forms of sugar. And from a nutrition standpoint, the food sources in which they are found have a lot more to offer. They have fiber and other things in them. So if we eat a whole fruit and it has natural sugars in there, there are plenty of other benefits. There is vitamins, minerals, fiber, etc. Added sugars are typically found in anything that is processed or prepared. And when large amounts of added sugar are eaten, it can definitely contribute to weight gain and poorly controlled blood sugar levels. So it's that added sugars that we really want to keep more of an eye on. Natural sugars in fruits, etc., we definitely want to have fruit every single day. Not too much of it, but it's more added sugars that we really want to try to limit. Sugary foods that are processed or prepared like that with added sugars are definitely considered empty calories. We're not really getting much out of them in the way of nutrition. And here are some food labels to look at. So really quick, we are going to touch on this because sometimes people don't realize that one of the biggest things that we need to pay attention to in a food label is our serving size. The amount of sugar listed on every food label is not necessarily how much you're eating. If you're eating multiple servings, you're eating more than what is listed there. You have to actually do the math to figure out how many servings you are eating. So the new label, which will have to be implemented on everything next year, does include added sugars. You'll see that on the right-hand side label. And to use this as an example of this label, if you have, let's say you have 3 servings of whatever this is, it would be 3 times 12. So the total sugar is 12. You're having that 3 times. So really, if you eat 3 servings of this, then you are consuming 36 grams of sugar. So it's just something to keep in mind. If you eat something, it's not necessarily telling you that that total is 12 grams if there are more than 1 serving in that container that you were taking from. And we are going to move forward here as well just because of time, but which of the following foods may contain added sugars? So we'll go through these really quick because it can be pretty eye-opening. Ketchup. So ketchup almost always has added sugars in them. We want to try other dips or toppings like mustard, hummus, or avocado instead because none of those typically have added sugars. Second one on there, sports drinks. So many kids are drinking Gatorade after soccer practice, and it's not necessary. We don't necessarily need to be drinking those sports drinks because they really do. They just have a lot of added sugars in them. So they provide the average recreational exerciser more sugar than the body needs is the bottom line. They don't need that Gatorade. They're just getting too much sugar. Steamed rice is not something that typically does have it in there. Salad dressing definitely can contain some added sugars. So many bottled salad dressings contain added sugars, and it's something to look at, especially next year, the new food label, to be able to see that added sugar amount. It will help us to determine whether or not it's a good salad dressing to buy. Non-dairy yogurt, many brands of flavored yogurt do contain added sugars. Consider trying plain yogurt and top it with your own toppings so that you know what you're putting in there and so that there are not added sugars. Keep in mind that all yogurt products do contain some natural sugars, which is fine, but some do contain added as well. Jarred tomato sauce is something else to keep in mind. Some brands do include added sugars there. Be mindful to read the label before knowing what is actually being added there. Canned fruit, look for fruit that is canned in juice, not in syrup. The syrup is definitely added sugar. Soy milk, look for unsweetened varieties. Granola, many brands may also add sugars to granola as well, so be mindful to read the label before buying or try making your own. Same with breakfast cereal. Some varieties do contain more than others, so check the label there too. Fresh apple, good to go there. That's all natural sugars. You don't need to worry about added. Peanut butter, a lot of peanut butter has added sugars to it, so try to find a more natural kind. There are brands who just have peanuts and a little bit of salt. That's the kind that I buy. So it should just have 2 ingredients on there, peanuts and salt, so that way you know that there's no added sugar. Air-popped popcorn is usually okay as well. Protein and healthy fats. So finally, protein and moderate amounts of healthy fats can help you control your blood sugar. They are digested more slowly than carbohydrates, and this means that they can keep you feeling full a little bit longer. They also can slow the digestion of carbohydrates so that sugar is released in the body more slowly. And a balance of carbs, protein, and healthy fats is important for general health and diabetes as well. So this is the last little bit here. We are going to go through a couple slides on physical activity. But physical activity is another lifestyle factor that definitely impacts your blood sugar and your risk of diabetes. When you move your muscles, your body usually uses sugar for energy, so that's helpful in general as well. And this can help to lower our blood sugar level since our body is using up some of that sugar. A glucometer is a device that you can use at home to test your blood sugar level, so it's very highly recommended that it can be used for somebody that has diabetes, but even pre-diabetes, to keep an eye on where your blood sugar level is falling. And it can be used before and after exercise to truly see the difference that exercise can make. It is a huge impact on your blood sugar when you do exercise. We also know that there are a ton of other benefits to physical activity as well. So not only can it help if you do have prediabetes or diabetes, but it also just improves insulin sensitivity in general. It is huge for stress relief. It can improve our blood circulation, tone our muscles, and then obviously strengthen our heart and our bones as well. So how much physical activity should you be getting? This slide shows you that you do want to get both aerobic and strength training. For aerobic, you want to be trying to aim for at least 150 minutes per week at moderate intensity or 75 minutes weekly at vigorous intensity. We also want to make sure that we're doing strength training at least 2 times per week. It's incredibly important to make sure that we're doing this. It helps us with our balance, our stability as we're getting older, and just helps us to gain a little bit more muscle as well, which helps us to lose fat. So in general, a lot of people focus on aerobic activity and getting that cardio, but we want to make sure we're incorporating strength training as well. If you are new to exercise, it's not realistic or safe to start at this amount right away. Make sure that you start slow and build. Maybe start with just 1 day a week. If that's what works for you and you get to 3 weeks of 1 day a week, you can add on to 2 days a week. But definitely slowly build. You don't want to go into it too aggressively and end up with an injury and starting back over to where you were. It is a really good time to just, or a really good idea to just slowly build over time and work your way up to that 150 minutes or 75, whichever you choose. Everybody is different, so try to also find something that works for you. If you hate running, maybe try to choose a different type of exercise and find a different type of exercise that you are actually going to want to stick with. 150 minutes of aerobic activity per week might just seem like a lot to start with, like we said, so start slow, but you also can break it up in a lot of different ways. So if you know that you are somebody that can't make it more than 20 minutes per week or per day, maybe you do 20 minutes every single day of the week. Plus, maybe you just like a daily routine and you don't want to get out of that routine. So 20 minutes a day, every day of the week. If you want your weekends free and don't want to have to go to the gym on the weekends or go for a walk, maybe 30 minutes a day, 5 days a week, Monday through Friday. Or if you really want to avoid exercising maybe the days that you work, maybe just do 50 minutes Friday, Saturday, Sunday. The bottom line here is as long as you're trying to meet the recommendations, that is all that matters. You can break it up however you like and however works for your body, but also for your schedule. So there's a lot of different options. And remember to give yourself rest days as well. Your body does need time to repair and recover too. So remember to take small steps in whatever changes you decide to make. Like I said earlier, you don't want to have to make everything different overnight. It's not going to happen. You do need to make gradual small changes and small goals. So set goals, and then once you hit those goals, then you add on to them. But make them SMART goals. Know exactly what you plan on doing next week, how many times you're going to work out, what you're going to do for how many minutes. Make sure they're very specific goals. And then, like I said, if you make it 3 weeks in a row that you worked out twice in a week, then you add on moving forward. But don't beat yourself up if you do stumble along the way. It does take time to incorporate new things into our life. The important thing is just to not give up and to continue to make those changes. This is the very last slide. I know we're just a little bit over here, but I just want you guys to think about one change that you can potentially make this week to support your health and well-being. There are different options listed here. You can go to the Healthy at Hopkins portal, which has really great resources listed. Review the American Diabetes Association website. Pack a nutritious afternoon snack instead of going to the vending machine. Choose lower sugar options with food and beverage in general. Choose to schedule an annual physical with your doctor if it's that time, or if you have not been tested for diabetes. And then walk for 15 minutes at lunch, maybe a couple days this week, or try to make it every day. But in general, try to think about one change that you as an individual plan on making this week. One thing that could impact your health and your well-being. And it can go a very, very long way. It can end up being a routine that you have in your daily life. so that is the end of our presentation. We thank you all for joining us. I apologize that we went a little bit over. Today we have learned what diabetes is and how widespread it is. We've also learned how it can impact our life, our well-being, and our health. So we do want to make sure that we start right now to work to prevent or to manage this disease. I will point out that if you look at the handout section on the GoToWebinar, there's a bunch of different tools there that are different options. If you go to the handouts one, there is a handout there. So you can double click there and download the Decoding Diabetes handout if you choose to do so. You will find that there. So you can download that handout, and feel free to send anything to the chat if you have any questions. I am here to answer any questions that you may have. Again, use that chat feature to send them over. Thank you so much for joining today. We have recorded this as well, and it will be available on the Healthy at Hopkins portal. So if you are somebody that thinks this could be beneficial for a family member or a friend, feel free to show them this webinar. Like I said, it will be recorded and put on the Healthy at Hopkins portal. We will stay for another minute or two here to see if there's any other questions that do come through. But thank you all again for joining, and I hope you all have a wonderful day. And my name is Erica. I'm with Healthy at Hopkins, so feel free to reach out to Healthy at Hopkins anytime with questions about diabetes or about the Healthy at Hopkins program, nutrition, physical activity, whatever it may be. Thank you all.